Hey everyone, thanks for tuning in. This is Dr. Savvy Ford from Blossom Family Chiropractic explaining why some kids get chronic ear infections and others don't. You know, with 85% of children actually getting ear infections, I would say they're definitely common, but know that your child getting ear infections is not normal. So why is this happening? Well, it's not because they're walking through clouds of viruses and bacteria. It's because fluid accumulates in the ear and inflames the tissue, providing the perfect environment for viruses and bacteria to set up shop. It just creates this stagnant fluid. But why? Why aren't their ears draining? Well, if you take a bite of food, it doesn't just drop into your stomach from gravity. Your esophagus is a muscle that milks food down. That's why you can swallow even if you were standing on your head. And it's the same process in your ear. There's a muscle called the tensor veli palatini that helps to milk fluid out of your ears so it can drain down your throat. In kids that get chronic ear infections, the tensor veli palatini muscle spasms and it doesn't allow fluid to go through the eustachian tube. So the question is, why would the tensor veli palatini muscle be in spasm and not let that fluid drain through the ear? Well, 9 out of 10 times, we can actually trace it back to the birth process. The tensor veli palatini muscle gets its nerve supply from the very top part of your neck, called C1 or the atlas, which is also the most vulnerable part of the baby during the birth process. With a normal vaginal birth, the doctor uses about 60 to 90 pounds of pressure to pull the baby out by the neck. Now, if there's forceps, vacuum extraction, or a C-section used, the doctor uses even more pressure and more stress to pull that baby out by the neck. So what happens is it actually affects that nerve that innervates the tensor veli palatini. It gets irritated and it stops working properly. So the muscle spasms and it doesn't allow fluid to drain. All of a sudden, kid gets an ear infection. So the question is, does an antibiotic get the fluid to drain from the ear? No. And does drilling a hole through the eustachian tube really seem like the best option? Of course not, because it's not getting to the root cause of the problem. And that's why the American Academy of Pediatrics and countless other medical research articles have said for decades now to not give antibiotics for kids with ear infections, because not only do they not help, but they significantly increase the risk of getting future ear infections as well as allergies and asthma. In fact, they'll tell you that the best recommendation is actually to wait and not do anything. So what can you do? Well, the number one thing is to get that tensor veli palatini muscle working again so it's not in spasm and so the fluid can actually drain through the ear, and that's where chiropractic comes in. With gentle and specific adjustments, we can actually get the kink out of the kid's neck, which restores the nerve supply to the tensor veli palatini muscle, and the ears will start to drain. We see this every day. Ear infections are actually one of my favorite things to work with in kids because we start to see their bodies heal and they become so much healthier. The good news is that there's a very easy way to find out if the problem behind the ear infection is neurological in nature. Any good pediatric chiropractor uses these scans in their office to find out exactly where the problem is. This is literally the same technology they use in astronauts to see if they're healthy enough for space. It's completely non-invasive, it's painless, there's no radiation, and best of all, there's no guessing. We know exactly where that problem is. The scans that you see here have a very clear output on the screen. That way you can see and we can see exactly where the problem areas lie. It looks something like this. This is a typical pattern that you would see when these kiddos come in with ear infections. You see those big red bars at the top? That's not good. That means the nerves going to the top part of the neck, where the ear, the nose, and the throat system are not well regulated and they're not working properly. After getting adjusted though, it looks something like this. It's nice and clear. The kid on the right, this is a healthy scan. Actually, both of these scans are this little girl Rachel's scans. Rachel came to us initially and she couldn't speak and her ears had been full of fluid for pretty much her entire life. Antibiotics didn't help. Her parents were considering tube surgery too, but luckily called our office first. We started getting her adjusted and her ear started to drain. A few weeks ago, the pediatrician confirmed there's no fluid in that ear and that she passed her hearing test for the first time in her entire life. Now, Rachel's already starting to speak. This kid's whole life got turned around and put on a different trajectory just because we got that fluid moving in the right direction. So, wouldn't that be great if that was your kid? If they didn't have to deal with all these things and they could just live that normal, healthy childhood that they were meant to? Well, good news is they can. The first step is to find a good pediatric chiropractor. Our office, Blossom Family Chiropractic, is located in the downtown portion of St. Petersburg, Florida. But I've had patients all around the world, all the way to even Australia, contact us to see if we could find them a good pediatric chiropractor in their area. And I would be happy to do that for you. Please contact me, email me. If you're not in the Tampa or St. Pete area, I'll find someone who is great and is going to take great care of you and your family. Thanks so much for tuning in, guys. I hope this was helpful and can't wait to talk soon.